Our passion didn't start with the mouth. It started with people, with the well-being of the profession. And if you're like me, maybe a little bit of your nerdiness and all things tech too. We all want to love what we do, but the truth is, burnout, people problems, and glass ceilings can keep us from doing what we set out to do. So let's get back to the heart of connection. Welcome to the Dental Handoff. This show is about passing you the knowledge, the habits, the systems, and the strategies to lead your teams, lean on your tech, and listen to your gut while you take care of people and truly the overall health of our communities. Let's stop using the wrong end of the toothbrush, y'all. My name is Dr. Kelly Tanner. Oh, and uniquely, I'm a dental hygienist too. You can consider me a guru in the dental and leadership industry. With over 3 decades of experience, my goal is to take you to the next level by empowering growth, perspective, and confidence. By identifying the gaps, recognizing the plaque, and extracting the truth with the other experts in the field. I'll share their stories, empower you to own yours, and elevate your passion in the process. So have a seat in the chair, put on your bib, and let's get to work. Welcome to the Dental Handoff. I am Dr. Kelly Tanner, and today I have with me the Amber Auger. Amber, I am so delighted to have you on today, and we're actually not at a conference together and doing this.
It was amazing.
It's like, hey, high fives running by.
Exactly, you know.
we have to go to Seattle and everywhere else to see each other.
I know it. We gotta do better here.
Yeah, we're already doing better. But thank you so much for being on today. It's an honor and it's a delight to spend some time with you. We always start with the question, why dental hygiene for you? Did it choose you? Did you choose it?
Ooh, I love this question. Why dental hygiene? Well, I watched Miss Frizzle. So literally magic school bus. Miss Frizzle slunked down into her tiny little Miss Frizzle bus. And that episode was like life-changing for me. And I was like, this is so neat. And we had a family friend. My mom's a single mom. We had a family member who was a family friend who was a dental hygienist. And she was like, I think it'd be a great career for you. Long story short, in the 6th grade, I went and shadowed her and was like, this is it. I'm going to be a dental hygienist. So age 12, I knew this is what I wanted to do.
Really?
Really? Yeah.
Isn't that so
Miss
fun?
Frizzle. Yeah, Miss Frizzle and Bill Nye, my mentors.
And the Tooth Fairy.
Exactly.
Of course, yes. And so did you go right into your gen ed courses and then you just went right into hygiene school? Is that how it worked for you?
Yeah, I went right into hygiene school from high school. And my goal was to actually go back to school to become a dentist. But I started dental hygiene with carpal tunnel. So I had my first cortisone shot in my scalar hand first semester of hygiene, right before leaving for first semester of hygiene school. And I remember the moment where my faculty member sat me down, was looking at my medical history and said to me, are you sure you want to do this? You're not going to be able to practice dental hygiene full time for 40 years with carpal tunnel. Like it's going to be impossible for you. You're starting compromise. Do you really want to do this? And I was like, yeah, absolutely. And 3.5 years later, she pinned me at my hygiene ceremony. So it was really beautiful and full circle. And she's reached out a few times and said, like, we're so proud of everything you've done with your career. So I'm so glad that I kind of crossed that obstacle. And I still practice clinically part-time with no pain in my wrist. I've done a lot of different changes with diets and supplements to help with it.
It makes a big difference with the inflammation in your body.
It does.
Well, so that's so powerful because someone said to you, are you sure? And that could have been your opportunity to opt out and say no, or you could have gotten into it. That was a high risk for you.
It was a very high risk. And the reality is dental hygiene for me, like dental hygiene school sucked. I have multiple learning disabilities that were not diagnosed until my junior year of college, where I have difficulty with testing, difficulty with comprehension. I would lead study groups and know all of the information and then get me into the classroom and watching everybody turn the page like they're on the next, packet page and I'm on the first question. I'm like, oh my God, I would just panic. I wouldn't actually be able to read the question. And it wasn't until a professor in the program pulled me into her office and said, I'm going to ask you all of these questions verbally with no multiple choice. And I said, okay. And she said, you failed this test, but I know that you know this information. We went through it and I got 100, but I had scored a 30.
Wow.
And she was like, we're going to send you to get testing. And I got tested, and all I needed was a little extra time in a quiet room. And that professor, being so intuitive that she was and being able to support me, I believe is the reason I passed my board. And the reason I went on to get a master's, because I knew what I needed to be successful as a student.
Wow. So that was a very empowering moment for you. And think about it now with students, they're coming in, a lot of them are tested, but then there's still so many who are just like, yeah, I just need a little extra time. Like, you just know that you need to slow down a little
Right.
bit more. But the anxiety that you experienced when you saw people flip the page, it probably just went through the roof of going, where am I? And it shut you down because you go into fight or flight.
Mm-hmm. 1,000%. And then, of course, worthiness came up, like, how, am I smart enough to be here? My friends could go out, party the night before, have so much fun. And I was in the quiet, like, library studying 9 hours for, a 1 hour quiz. Nobody else studied and got 100, and I'm failing, even though I was studying, but I was overstudying. And I had no idea what I needed to be successful. And the reality is that it was just life-changing to have the support that I needed. And I graduated my master's degree with a 4.0. So it just shows you the difference. Mm-hmm.
Yeah, but the nudge that professor took to say, something's not right.
Mm-hmm.
And I think so many times we ignore that, and just, especially, I feel like in my own experiences of what I've hearing, it's just cutthroat a lot of times in dental hygiene programs, where it's you perform or you don't perform. And if you're not here for it, there's the door, because there's 10 more people who want your spot. Mm-hmm. It has been like that historically. I think it's changing somewhat.
Not quickly enough, but yes. I mean, I think there's a lot of trauma built into our hygiene programs, and it's sink or swim. It establishes a comparison type vibe, and there's always this huge anxiety cloud chasing over us. Are we going to make it? Are we good enough? Is this what it's going to be like when we're practicing clinically? Can I find a bored patient? We don't really set, in my opinion, students up for success.
And this carries over to private practice with the competitive nature, the not thriving in your op, the opposite of what it's about, like withering away in your op or leaving the op in that, because we know that one of the main reasons why people leave is workplace culture. So I think that we are conditioning these individuals, the dental hygiene students, being a program director, I went at it differently. And I didn't want to recreate that experience. And so you needed to come to me with questions. We needed to have an open line of communication to maintain that neutrality, to say, what is it that you need to be responsible for? Okay, here's my line of responsibility. Here's your line of responsibility. How are you going to step up here and encourage and promote that and say, okay, how can I support you? Which I felt like I was a parent almost sort of in that role, because I wanted to give them something that I didn't feel like I had. But I think that will serve them throughout their career to make them those team members that we are. And so are you finding this? I know, Amber, that you are the trademarked and professional in the thrive in the op. So are you finding that people are experiencing this kind of clash and the burnout?
Oh, yeah. And the reason why Thrive in the Op was created was because during COVID, I saw so many people running out of the operatory doors and feeling like, I'm burnt out. I don't want to do this. And with talking with them, I'm like, well, what are you burnt out about? Right? What is causing this burnout? As a hygienist, right? I go into the Miss Frizzle dental hygiene detective of what's the root cause of your burnout? Let's talk about this. And what I realized is they were in the wrong offices, or they weren't having conversations about things that were bothering them. For example, they hadn't had new instruments in 5 years. So my follow-up question is, well, how have you asked the doctor? Well, I haven't asked the doctor. Well, maybe the doctor has no idea that you need new instruments. Let's think about that for a moment.
Mm-hmm.
They have so much going on. The doctor isn't saying, how can I make you run late? And how can I just destroy your hands? And I want you to feel so much pain in your wrist. Let me not buy you new instruments. The reality is there's so many different factors that an owner of a practice is going through. And don't even get me started. We all know what we all went through, which was hell during COVID, of getting locked down, trying to figure out all the PPE things, trying to figure out the cost, trying to figure out the new normal of dentistry. So all of that is kind of a residual trauma. The reality is when we go through one bad experience with an employer, it's really easy for us to say, oh, all dentists are like this, or all offices are like this. And if we're not healing that previous experience and not taking ownership of our role in that previous experience, we can't progress forward. So Thrive in the Up is really giving the individual, the dental hygienist, all of the business and clinical skills that they didn't learn in hygiene school to not only be an advocate for themselves, but to be aligned with the practice that they want to be really aligned with. And that can look like an airway practice, a overall sleep apnea practice, a implementing salivary testing into their current role. And what's been really beautiful is seeing the hygienists who come into Thrive in the Op who are burnt out, exhausted, thinking that they might want to leave the op forever, to now making more in less time, identifying production ethically. We don't recommend that just everybody across the board gets fluoride and that's a magical production boost. No, we look at the root cause and we make evidence-based decisions, and we look at how we have scheduling diversity in our everyday to make sure that we can optimize that production. I produce about $3,500 a day as a dental hygienist with 9 patients. My goal is $1,500 from my office. So I've figured out how to hack where the schedule, where we're not doing it where we're saying, oh, you have gingivitis, it's 4 millimeters, let's scale you. But we're saying, if you have disease, I'm not going to be treating you with a prophy. So it's a matter of ensuring that we're not compromising our standards from the standard of care and ensuring that we're enhancing it, because the standard of care is not to get sued and not to kill a patient. It's not actually quality care. It's the bare minimum.
Yeah. And what I realized by when I'm consulting too, is that many hygienists, although we know that we need to be probing, there are many who are not probing or just spot probing or think that they know their patient. And so magically they get to like heal that's a real thing. And I think something that you touched on initially too is the avoidance that we have, because we don't want to promote, we feel like we're going to create some type of conflict because where is that root coming from? So I feel like if like through Thrive in the Op and what you're teaching them with the business skills and how to have those conversations, those aren't conflicting conversations. They're just you asking for what you need. And really anything in life is just you asking for what you want and what you need.
And how you show up, right? So if you're showing up thinking that the bosses, whoever your boss is never going to buy you instruments or is never going to do X, Y, and Z, that's the reality that you're going to create. Your mind always loves to be right. So if you're walking into your day saying, oh my gosh, today's going to be terrible, I feel so anxious already, all these patients are going to be late, you're going to find ways that you're running behind. And even if that patient has arrived on time, you're late for them and it feels like they're late. So our brain always wants to prove us right. So much of this is processing our feelings, recognizing those feelings before we have the conversation, and only having the conversation when we are in a neutral spot, not when we're super heated and we're going into the office like, I gotta talk to you about something, and then we don't show up the best. Instead, coming in with, here's what I'm concerned about as far as the instruments goes. I'm concerned about the fact that they're really putting a lot of stress on my body and my ergonomics, but also it's more painful for the patient. I want to ensure that the patient has the best experience in here, and so much so that we're attracting new patients into the practice. This is why I would love to talk to you about an instrument budget. Very easy to have that conversation.
Yeah. And then even beyond that too, if you have multiple dental hygienists in the practice, come to agreement on what you all would use and what, if you want a S204OS or you want a whatever, come to agreement and say, we've all agreed, all 5 of us, that we want to use this. And here's the budget for that. And we're all in need of X amount. And here's how much it would cost. We've talked to, come to them with solutions. Yeah.
Yes, exactly. Not just the problem, but I love it. And work together ahead of time. So it's an easy yes. It's an easy, okay, here's the credit card.
Yeah. And many offices, I don't know if you know these doctors, they'll say if it's $1,000 or less, order it, or $500 or less, order it. Like anybody in their team could just order it. So that's a culture. So you're choosing the culture, you're taking accountability for your part in that culture and what you're perpetuating. But a lot of it, like Amber said, is to understand your thought process, because you attract who you are. And so if you go in and you're negative and you think there's going to be conflict, guess what you get? Guess what you get?
Right.
So
I
thriving
feel like I see on your Instagram, you attract what you are.
Yeah.
I love that.
It's sort of a big thing. It's my jam. It's my jam.
I just quotes. I love it.
Thank you.
You're welcome.
So with Thrive in the App, it's an online program. Do they get access to you? I have questions.
Yeah, I love that you have questions. So it's on demand, and lifetime access. So they can watch the different topics. They can go out of order. They can stay in order. Thrive in the App is designed to kind of be your clinical Eras tour, really, because I love Taylor Swift. Why not? And it's in every era of your career, whether you're a new grad, whether you are in your overall business era and you want to learn about production and KPI numbers, whether you want to learn more about perio, how to treat perio, what to recommend, salivary testing, what to recommend when. So we have a really vast variety of on-demand topics. And then we do bi-weekly live coaching. All of our coaching is available on demand, and they're in a private group where they have access to me 24/7. So if a question comes out throughout the week and they're panicked of, oh my gosh, I'm implementing this, I just used this new product, I'm not sure if I used it correctly, I'm concerned about the patient, or hey, we're having a debate in the office between a D4910 and a Prophy, can we rotate those? Tell me, help me. Then we go in and I answer the question right in our private group. Then we also have guest experts who come in and lecture on a wide variety of topics. So 12 continuing education credits with it. And we also have a Thrive in the App Perio workbook that's over 200 pages.
Wow. I just saw that you're offering some freebies right now on Instagram. Yeah.
Yes. So we offer freebies a lot as well. So we have a freebie ebook for perio all around coding and kind of decision tree making, a workflow chart of reviewing the codes and what to use for what inflammation, and then a high blood pressure form as well. So when to refer the patient out. And all of it is free.
Yeah. When to say to your doc, hey doc, their blood pressure. Well, first of all, take blood pressure.
Yes.
First, let's just start there.
Let's start there.
Yeah, let's just take blood pressure. And then when do you not treat? What's the threshold? Because that's a whole risk right there. And so it sounds like that your one sheet or your guidance documents provide that.
Yes. And then they're set so that you can put the office logo on it. So it's a template where you can just stick the office logo on, you can adjust what you want. But it's really important that when we're referring out to, that we have documentation that we're referring out. So we can't just simply say, you should go see X provider. We need proof if a lawsuit were to happen to be protected, that not only did we refer them out, we have the information and the evidence of that, but also that we followed up on the referral. So there's been multiple lawsuits recently where people are sending out patients for an oral cancer, a concerned area of potential oral cancer. And the patient never returns back to the practice. So what happens 5 years from now, if that patient does pass away to oral cancer, are you on the line if that patient never went for the referral? So we can't force them to go in, but we do have to have documentation that we followed up on the referral.
Yeah, closing the loop.
Yep.
And then put it in the chart.
Right. If it's not written, it did not happen. So correct. I'm a novel gal.
Yeah. And then, so you, Amber, you're still practicing.
Yeah, I still practice weekly, usually Tuesdays, and then sometimes Thursdays, depending on speaking schedule, but at least every Tuesday.
That's
Which
awesome.
It's my favorite time of the week. I love practicing clinically. All my patients have become like friends, and it's so rewarding to watch patients get healthier in the chair.
Yes, it is. Did you find that, okay, so how many other hygienists are in your practice that you work in?
2 other hygienists.
Okay. So you're coming in every Tuesday, sometimes Thursday.
Mhm.
Did you bring in a lot of this change in your practice, or were you a part of something that was already there?
No, I brought a lot of change in. I was hired to be the dental hygiene fixer.
Hmm.
So there was no FMXs, no perio charts, and I was hired to help expand the standard of care. And then from there, what we did is I said, hey, I want to try salivary testing. Can I try it in my op? Sure, you can implement it, try it in your op. And I'm not your normal RDH, as you're not, but I brought in my own instruments. I brought in all of my own technology. So saddles, everything from the saddle stool to intraoral camera to my own PAs I brought it into the practice. Air polishing happens in my room. So my standard, I run my operatory like I would be running a office if I could own a dental practice here in
Hmm.
Massachusetts.
Same.
Mhm.
Same.
I would
Yes.
love to own. Help
Yeah.
us.
Help us own our
Help us
practices.
own our
And then the
practices.
dentist going, they know not of which they're asking.
Right. They're like, dude, you don't want to own.
You're like,
I'm
don't
like,
do
no,
it.
I do.
Don't do it. Step away from the building.
6 months later, Kelly, what do we do?
I don't know. So you were hired as the fixer. How was that
Mhm.
stepping into that leadership role? I have two questions. How was
Yeah.
it stepping into that? And then how seasoned were the other hygienists that you were asked to fix?
So this is a fabulous question. So what has happened in legitimately every single clinical role that I've ever had since I graduated hygiene school in 2010 is there's usually not a great perio program. I should
Mhm.
say there's one, my first job, I worked 6 days a week in 3 different practices as a hygienist in my first job. So they're all kind of at the same time. But one of them is Sound Dental. And Sound Dental is in Connecticut. They have a fabulous perio program, and the hygienists in there were really great mentors. So I saw what I was learning in school being implemented in this one practice. Everywhere else, it was a little kind of scattered. Of sometimes we're recommending scaling on 5 millimeters, sometimes we're not. In one room we are, in another room we're not. So I have seen the standard of care not being implemented across the board. So I'm used to going in and now having to find the verbiage, the skills to be a new face and to be telling the patient that has had perio for 10 years that
Mhm.
they have periodontal disease without throwing that other provider under the bus
Right.
and without throwing the clinicians that are down the hall, the dentist that has their name on the door, under the bus. So I've walked this fine line of how to implement it. And this is where it all comes down to showing the patient evidence of the disease, having really strong verbal skills where I'm not thrown off if a patient seems to be skeptical about it, and really partnering with them in their oral health to say, we've got to make some changes on this. And that has been the most rewarding and fun part of my career. And that's why I love it, because a lot of times the other hygienists will be like, oh, you're never going to be able to do all of that in an hour. And they doubt me. And I love being doubted. I'm like, you doubt me and I will show you what I can do.
Yeah.
Throw a
Yeah.
little salt on me, a little salt and pepper, we're going.
And then, so with the practice that you're in now, and you were the fixer, were they newer graduates? Were they seasoned?
Seasoned. Seasoned.
Hmm.
So one of them has been practicing for about 40 years and the other one 35. And the beautiful thing is the one full-time hygienist in our practice, we're complete opposites,
Mm.
but we respect each other. So, initially she was doing a lot more hand scaling. I'm in there with an air polisher. She had never seen SDF. I'm like, hey, can you come help me? I've got 2 occlusal, need some SDF right now. We are not letting this turn into a cavity. Come over here and help me, place this, and teaching her how to place it. And the most beautiful thing is we've seen how opposites can work really well together.
Yeah.
She's the hygienist who wants to read the manual. I'm the hygienist who just wants to know the facts, what not to do, what to do, and I'm trying it on the patient. But she needs to look at all of the clinical evidence. So it's a really good yin and yang.
Mm.
And I've watched her improve her practice so much. And I've watched her become more confident with her verbal skills. So by having me in there, I'm not forcing her to try to level up. And I think as hygienists, a lot of us are type A and we want to fix things and we want to sometimes drag people along and shake them and say, like, how could you not be probing every patient every time? What are you doing? But as long as we are showing that it's possible and we're coming in confident and we're seeing the results, that is going to ricochet among the entire team.
Yeah. It's the
Mhm.
vibration. It's the vibe.
Yeah. Hmm.
Yeah, because that can be very intimidating when you're coming in and you're hired as that hygienist to, hey, fix all and
Hmm.
wave the magic wand and do the things. And people have to trust you and trust your
Hmm.
leadership, and you have to forge your own way, and they have to want it themselves.
1,000%. And I think it's so easy to get into that environment and get negative. And instead, I'm finding things every hour on the hour with my patient to belly laugh at. We're having a great time in my op. I'm alerting the dentist and having them come in for an exam. And as soon as they get there, I treat them like the king or queen that, like royalty. Oh my God, thank you for coming on time. Come on in. And I'm jumping up and we're doing the exam. Um, so it's been really, really rewarding to see how when you walk in with an abundant mindset, what can happen in your
Yeah.
life, but also the lives of your patients and with your peers. Mhm.
Well, it resonates. There's a ripple effect that
Mhm.
happens throughout it all, because we take work home, we take home to work. And so
Mhm.
if you can have a great day at work every day or most days, or feel like you've touched someone's life and
Mhm.
made that difference. And sometimes I know that you save lives, we all save lives.
Mhm.
And with the small things that we're recommending, and sometimes it's the big things through hypertension or diabetes or
Right.
things that are showing up in the mouth, that we
Mhm.
can be that person for that
Mhm.
patient. But then you're taking that home, and I think that just
Mhm.
it improves everything. Just mindset is everything.
Of course. I had a time in my career where I wanted to leave dental hygiene forever.
Mm,
And I had a time in my career where I was driving to and from work and crying because I felt like I would never find an office that was aligned with me. I was full time in a position, and the quality of not even it was the quality as well as the consistency of care just wasn't there. And I was going to the practice owner and saying, I'm concerned about this. This was charted as a 1. Look at this vertical bone loss on this x-ray. It was charted as 1 millimeter pocket. This is a 7 millimeter pocket. And this patient has been on a prophy. And I recommended scaling. The patient was booked back with the original provider. And now they're being told that that's normal. I can't do this. And the doctor would just every time I would talk about this and ask how we could fix it, would just give me more money.
oh,
And this was a practice that I was in when I was going through my master's degree. And I was like, I don't know how I can do this. I don't, it's great to make more money, but I feel like I am being known as the mean hygienist or the bad hygienist because I'm telling the patient that they're in disease, but down the hall, their disease is not being treated. Like I'm in this ethical dilemma. What do I do? And
mhm,
the office was close to home. I loved my patients. I was so scared to leave this office. The doctor and I had a great relationship, but there wasn't accountability that would allow me to grow. And day after day, I felt myself resenting it a little bit more. And I felt myself kind of not being as excited to do an exam and not sharing as much information in the exam. And it came down to one day where I looked at my tray to see if I had already polished because I was shutting my mind off to survive in an environment that was no longer supporting my growth and no longer feeding my soul.
mm,
And I was like, something has to change. And I ended up getting a different job. And then it was that right after that, I graduated my master's and actually got into speaking. So the biggest thing that I think happens in our hygiene career is we get so invested in our patients
mhm.
and we allow our patients to sometimes keep us in an environment that is not for us. And what I will say is, of the offices that I've left, I've never had an experience where I'm not contacting patients. Patients find me. They're Googling me. They're Googling like Margot, my little dog. They're like SEO in it. And patients will find my contact information, whether it's through Instagram or through email, and say, hey, where did you go? I want to follow you. Like, thank you so much. The letters I've gotten. And that is what I'm so proud of, is the fact that as a dental hygienist, we get to identify disease at its earliest stages. We get to play an epithelial tissue that's only 4 to 5 cells thick that tells us so much information about what's happening systemically. We get to check in with the heart of the patient at least twice a year for 1 hour, where most physicians get 15 minutes. Talk about, just the terrible healthcare system that we have, where you only have 15 minutes to check on your entire body. I will say I recently went to my PCP. I was upset about the 15-minute thing. She had 15 minutes to chat with me. There was 2 survey questions that I was really excited about. The first was, when was the last time you saw your dental provider? And the second was a series of questions about mental health, which I was like, these are great. But the fact that dentistry was coupled with that, I was like, we are good. So that made me happy. But we have such a unique ability. And the reality is our patients are coming back to see us. They're not coming back to see, the dentist. As great as the dentists are, they're coming back for that support.
They're coming back for us because they get that time with us. We make the time where we're their first responders almost to things that we're noticing and picking up on and alerting. So what are some words? What's a word of advice? Like if you had to tell anyone anything based on today's conversation, whatever that may be, 1, 2, 3 things, what are some things that you would say? Leave us with.
Yeah. I will say your career is what you make it. And you can change your cards in any time. It's never too late to start something new. Doesn't matter what your zip code is. We've had hygienists in Omaha, Nebraska find a functional dentist to work with and get into airway and myofunctional therapy coaching. And I'm here to support you in whatever stage you're in your career. I want to see every hygienist thrive in the op, because once you learn how to thrive in the op, you can take those skills and those tools and do anything that you'd like with your career.
Good words, sage advice, my friend.
Thank you.
Awesome.
Thank you.
It's so nice to have you on and spend time with you. Thank you so much for being on today.
Of course, I'm honored. Thank you.
Yeah. So if you guys want to get more of Amber, her contact information is in the show notes. Also, Thrive in the Op is her baby, where she offers a lot of great advice, a lot of education, CE, one-on-one, a lot of amazing things that you're doing, Amber. So thank you for all that you're doing to support our community and the health of our patients.
Of course. Thank you for all you're doing.
Yeah, it's for the love. It's all through the love. It's all for passion for me. So my friends, I always ask the favor of you, go over to Apple Podcasts to give a 5-star rating of the Dental Handoff. Go over to YouTube, like, subscribe, and share. So it will share the podcast with other people who are like you, who like to hear stuff like this. Thank you everyone for what you do every day, for all the lives that you touch every day. And we will see you again next week, my friends. Be well. Thanks, Amber.